Welcome guys to another YouTube video. So today's episode I'm going to do something on endometriosis, right? Endometriosis, right? So I hope once more you learn something. We're going to learn something new, right? Yes. So let's continue learning. Let's continue sharing, right? Let's interact in the comment section. Please remember to subscribe. Many of you have not subscribed yet, right? So just click the subscription button. Just take 1 second. Subscribe, right? Like and share the video. So as I've said, today we're going to do an episode on endometriosis, right? So endometriosis basically is a condition that can affect any lady. It can affect any woman, right? Or any girl, right? Yes. So what is it basically? What is this thing called endometriosis? So endometriosis is often a very painful condition where the tissue, the lining of the uterus, what we call the endometrium, the tissues of the endometrium, they grow elsewhere, right? They grow elsewhere apart from the uterus, or what we call the uterine mucosa. So before I mention anything more of that, let me mention something about the anatomy of the uterus. So the uterus is made up of 3 layers, right? The first layer we have the perimetrium, which is the outermost layer of the uterus. The second layer we have the myometrium, which is the middle layer of the uterus, and the innermost layer is the endometrium. So in endometriosis, you find that these tissues, the tissues of the endometrium, they grow elsewhere, right? Elsewhere apart from the uterine, because apart from the uterus, they may grow in maybe in the ovaries, right? They may grow in the oviduct, even in the lungs, right? Even in the colon. So we find that these tissues, they grow elsewhere apart from the endometrium, right? So it affects many people, right? It affects many people. But again, there are some situations where endometriosis does not present with any sign, right? You may not know that you have endometriosis until that time you cannot get pregnant, right? Or maybe another surgery has been done, and maybe the surgeon realizes that you have endometriosis, right? So not everybody will have symptoms of endometriosis. Some go symptomless, right? Yes. So talking of endometriosis, right? We say that the tissues of the endometrium, the lining of the innermost layer of the uterus, they develop elsewhere, they grow elsewhere, right? They can grow on the ovaries, the fallopian tube, or even on the colon, right? Even on the lungs, right? Yes. So, being that they are layers of the uterus, which are the layers of the endometrium, they behave exactly the way the layers of the endometrium behave. What do I mean? What I mean is this. Let's say, for example, the menstrual cycle, right? During the menstrual cycle, there is a time, there is a phase in the menstrual cycle where there's high level of progesterone, right? So the high level of progesterone causes the wall of the uterus to thicken in preparation for pregnancy, right? Which is the endometrium. It causes the endometrium to thicken, right? So when you conceive, the progesterone maintains pregnancy, right? But if you fail to conceive, fertilization fails to occur, the levels of progesterone falls down, or there is a surge in the level of progesterone, right? And what happens? The layer of the uterus, which is the endometrium, sloughs off, right? And that is what we call menses, right? So when these tissues of the endometrium, let's say they grow on the ovaries or on the oviduct, right? They behave exactly how the tissues of the endometrium in the uterus behaves, right? So what do I mean? During the menstrual cycle, they thicken the same way the ones inside the uterus thickens, right? They sloughs off when you fail to get pregnancy, and this may make it present with a lot of bleeding and a lot of menstrual pain, right? Yes. So the hormones, the they're always stimulated by the cyclic hormones. For example, the hormones of the menstrual cycle, the likes of progesterone, the likes of estrogen, luteinizing hormone, right? They are this kind of hormones stimulate this tissue to grow, right? Yes. However, there are certain hormones that suppresses them. We have the continuous hormones, the likes of insulin, the likes of cortisol. This one suppresses this growth, right? But again, this endometriosis is a condition of contrast, right? What do I mean? Endometriosis is the growth itself is benign, right? So that means that it's non-cancerous. So what happens in endometriosis? In these tissues, they invade the locally available tissues, which is a contrast as far as benign tumors is concerned, right? We don't expect benign tissues to metastasize, to invade the local tissues, right? But the tissues of the endometriosis, the growth invades the locally available tissues, right? So the tissue is locally invasive. That means that it spreads to the nearby tissues, right? So what are the common signs that endometriosis can occur? It can occur in the ovaries, right? It can occur in the oviduct. It can occur on the colon, most probably the sigmoid colon. It can also occur on the pouch of Douglas, right? So you find that if it occurs in the pouch of Douglas, for example, it causes a lot of pain during sex, right? Because during sex there's irritation on the pouch of Douglas, right? So it causes a lot of pain, right? Yes. So there are some areas that it rarely grows on those sides, but it can occur. It can also occur on this side, right? It can occur on the lungs, but it's very rare. On the lungs, on your ureters, right? It can occur on the kidney, but on a very rare basis, but it can occur, right? So how do you know that you have endometriosis? What are some of the presenting signs that can tell you that you have endometriosis? But again, these signs are not they're not telling us exclusively that you are having endometriosis, right? They can also be signs of other conditions, right? So we have three conditions that can be confused with endometriosis. We have something we call ovarian cysts, where there's accumulation of fluid on the ovaries, right? It can present the same signs as endometriosis, right? Apart from ovarian cysts, we have something called pelvic inflammatory disease, or PID, pelvic inflammatory disease. It can also present the same symptoms as endometriosis, right? It can have the same symptoms, pain during sex, right? So pelvic inflammatory disease basically is an infection of the upper genital tract, the likes of uterus. You have infection of the uterus, you have infection of the oviduct, you have infection of the ovary, right? That is PID. So it can be confused with endometriosis, right? I've talked about pelvic inflammatory disease. I've talked about ovarian cyst, and the last condition that you can confuse with ovarian cyst is irritable bowel syndrome, right? So these conditions can be confused with what we call endometriosis, right? So you have to get the right diagnosis from your physician, right? So what are some common signs that can tell you that you have endometriosis? So one, painful menstruation, what we call dysmenorrhea. So in 70% of people who have endometriosis, they present with painful menstruation, what we call endometriosis. 70% of them. You find that before the pain can begin before menstruation, the pain can occur during menstruation, the pain can occur even after menstruation. So you present with painful menstruation because we've said the tissues of endometriosis, they behave the same as the tissues the tissues of the uterus, right? During menstruation, they also slough off and they pass as menses, right? Yes. So this can present painful menstruation, what we call dysmenorrhea. That is 70%. Others, about 20%, can present with what's called menorrhagia. That is heavy menstruation. You bleed a lot. Just imagine you have growth, the endometrial growth on your ovaries, maybe on the oviduct. So during menstruation, all of them slough off, right? So they come out as menses. So you can have heavy bleeding, right? So that is what we call menorrhagia. That is about 20% of the people who have endometriosis. So the third one is pain during sex. We've just mentioned that endometriosis can occur in the pouch of Douglas, right? So during sex, there's stimulation and there's irritation in the pouch of Douglas, right? And this can cause you pain during sex, right? So please note that every time you're having sex and maybe you are having pain, it does not mean that you have endometriosis. Pain during sex can also mean other things, right? So you need to get the right diagnosis from your physician, right? So another thing is difficult urination. Let's take a situation where you have endometrial growth on your ureters, right? So you may have very painful urination, right? At the same time, you can have blood in urine, what we call hematuria. So that can be a presenting sign. You find that maybe there is growth in the ureters, right? So that can be a sign of endometriosis, right? So apart from painful sex, apart from difficulty in urination, apart from blood in urine, apart from painful menstruation which can occur before, during, or after, apart from heavy bleeding, again you can be infertile. It can cause infertility, right? Maybe you have tried unprotected sex for a period of 1 year and you're not conceived. You're wondering what's the problem. You may be having endometriosis. So it has been found that 20 to 40% of people who are infertile are having endometriosis. 20 to 40% of those people who are infertile, there's a high likelihood they are having endometriosis. 20 to 40%. And again, those who have endometriosis, 40 to 60% of them may be infertile, right? So it is not also absolutely the number is so big. For example, 40 to 60% of those people who are having endometriosis, they are high likelihood they are going to become infertile, right? So how can you become infertile when you are having endometriosis? So for example, let's take a situation where the growth is on the ovaries, right? So if the endometrial growth is on the ovaries, right? So for you to conceive, there must be a release of the ovum, or what we call the egg, from the ovaries, right? And they have to meet the sperms, right, on the oviduct, right? So let's say a situation where the growth is on the oviduct. The most probability is that the growth will block the ovaries from meeting the sperms, right? And fertilization will not take place. And that is one way that endometriosis can cause you to be infertile. Again, the growth can also destroy the sperm, they can destroy the ovaries, right? And then you become infertile. So 40 to 60% of people who have endometriosis, they may be infertile. And for those who are suffering from infertility, those who are infertile, right? 20 to 40% of them may have endometriosis as one of the causes, right? Yes. So if you see this kind of signs, right? Don't sit back. Don't just say that pain during menstruation is normal, right? Pain during menstruation is not normal, right? There's an extent. It may start just a slow instant. You have very little pain, but as time goes by, it becomes very intense. So if you're having heavy menstruation every time you are going through your menses, seek help. Right? Every menstruation, you have very painful menstruation. Don't take it as something that's very normal, right? Yes, you have pain during sex, you have difficulty in urinating. Also, you find it very difficult to let's say you are the bowel movements, right? So you find it difficult to you have difficulty during bowel movement, right? So it can be one of the signs of endometriosis, right? So if you see these signs, don't just sit down, don't just assume that everything is normal. Please consult your physician for further investigation, further diagnosis, right? Yes. So in the next episode, I'm going to do something about the causes of endometriosis, what causes endometriosis, and what are the risk factors, what can predispose you to endometriosis. So let's continue learning, guys, right? So please remember to subscribe. Just take 1 second of your time and subscribe, right? Please share the video, and please comment what was your experience, how was everything after. Maybe you had endometriosis, how did you go about treatment, right? So the next episode I'm going to do something about causes, so stay tuned. After that, I'm going to do something about management. How can you manage it if it occurs, right? So I hope you learned something. Please subscribe to remain tuned. Let's see you on to the next.